Antibiotics as we know them have only been around since 1928, so less than 100 years. When they first came around, they were described as a wonder drug, and that's really no different from today. But we're at risk of losing this critical tool in keeping ourselves and keeping our pets as healthy as possible and treating some of the most common diseases that otherwise would be fatal, or being unable to carry out vital surgeries that will help maintain the well-being of our pets. And with this week being World Antimicrobial Awareness Week, I wanted to celebrate antibiotics and the huge benefits that they bring to our pets and to our lives, but I also want to give a warning and answer some of your questions to make sure that they're around for many years to come.
Welcome to the Call the Vet Show, the podcast that helps pet parents understand and optimize the health of their furry family, so they can live the full and happy life you want for them. And here's your host, veterinarian Dr. Alex Avery.
Hello, and welcome to another episode of the Call the Vet Show. Welcome along, and if we've not met already, then my name is veterinarian Dr. Alex. I'm the host here on the Call the Vet Show, and if you've got a dog or a cat and you want the best for them, then this is definitely the podcast for you. So make sure you hit that subscribe or follow button on whatever app you're listening to the show on. I hope you've had a little bit of a less hectic time than I have the last couple of weeks. So I normally do my recordings on a Wednesday when the kids are at school and I've got the house to myself. True to form, I needed to record a few episodes and the kids weren't very well a couple of weeks ago, so I didn't get that recording session, and then I was away from work this week. On the plus side, I did get a night out in the hills, camped up on the top of a mountain, which was amazingly beautiful in the morning. It was freezing cold and I wasn't quite prepared for those temperatures, but there was a cloud inversion, so I was above the clouds, glorious sunshine, and Mount Cook was in the distance, which is the highest mountain in New Zealand. It was a really beautiful sight. So although it's been hectic, I've had a little bit of me time as well, which is always appreciated and comes along relatively rarely. But anyway, as I said, I really want to talk a little bit about antibiotics or antimicrobials with you today, because we are potentially at a tipping point. It is vital that we use this hugely important resource appropriately, responsibly, and we're all part of this team, because otherwise it may get to the stage where we've got superbugs proliferating and some of the most common ways that we treat some of the most common conditions will just become completely impossible in the future. In fact, one of the biggest risks to health, the healthcare of our pets and also of ourselves, is the fact that antibiotics will become almost useless. We won't be able to treat these most common conditions. We won't be able to perform some of the more invasive, some of the more complex surgery, which equally can be very common as well. So with that warning in mind, let's jump into the topic today.
And now, on with the show.
And to understand the importance of antibiotics and where we've kind of come in the last 100 years or more, as you'll hear, I wanted to dive back into the past. So antibiotics, not in the truest form that we think of them today as coming in a pill, but they've been available for millennia. We know that different civilizations across history have used things like moldy bread, which the Egyptians actually used to pack wounds. So even though they didn't know that there was an infection caused by a bacteria, they recognized this property in mold as helping treat wounds and keep them healthy and aid healing. And it's actually thanks to mold that in 1928, Alexander Fleming, who you may have heard of, discovered antibiotics in the modern sense. So he was performing some experiments, and actually one of his experiments got contaminated with this particular type of mold. And he noted that the bacteria weren't growing where that fungus was. He then isolated that, found that it was incredibly powerful at preventing bacterial growth. And long story short, antibiotics in the modern world was born. And by 1944, in D-Day, penicillin was being used regularly in our troops and was actually called the wonder drug, saving many, many lives. And then the final feather in the cap, if you like, for Alexander Fleming was that in 1945, he won the Nobel Prize for discovering and creating the first mass-produced antibiotic. Now, we've come a long way since then. There's a lot of different classes of antibiotic. They come in all different flavors, different spectrums of activity. They act on very specific bacteria, types of bacteria. They penetrate different parts of the body, some better, some worse. So the right antibiotic for the right infection is really important. We don't really think of antibiotics as some being stronger than others. It's that spectrum of activity that's very important. So some antibiotics are going to be very useful in a particular type of infection, where another antibiotic may be completely useless. Vice versa, that useless antibiotic, in inverted commas, may well be fantastic for a completely different type of infection, which that first one is then completely ineffective against. So we don't really think of antibiotics in terms of strength. It's more that spectrum of activity and making sure that we've got the right diagnosis. We know ideally which bacteria in an ideal world is causing the problem. We know where that infection is, and we make the best choice of antibiotic based on that information. Now, sometimes we don't have all of that information. We might know where that infection is, or we might know what the main symptoms are, and then we will often make a best guess as to what the most common types of infection are in that area, and then use the most appropriate antibiotics. So we're not always going to send samples to the laboratory to see what they culture and then to see what antibiotic is most appropriate. We often use data that we've collected in the past to know which is most likely, and so which the best option is to treat your pet. Having said that, we are moving to a situation where more and more we are trying to get that culture result so that we can select the right antibiotic in the first place. There's a number of reasons for that. The first is that that's just the best practice that we can do to make sure that we are going to maximize the speed of recovery of your pet. But also, we are getting more and more resistant infections. So they can be multi-resistant infections, meaning that sometimes even lots of different types of antibiotics are ineffective against a bacteria which in the past would have been killed by those antibiotics. And the reason that we get these multi-resistant infections, or even just single resistant infections in those bacteria, is through the inappropriate use of antibiotics. So that's when we're using antibiotics for maybe conditions that don't need antibiotics in the first place, or we're using them inappropriately. So the dose that we're using is wrong, often too low. So we're actually not kind of killing the bacteria as effectively as possible, and they then develop a resistance to it. Or we're stopping the treatment earlier than we should have done. So we've not completed that full course, and that's caused problems as well. And of course, it might not even be in that individual animal where these problems have occurred. This is a global problem. It's a problem across the human health system, the companion animal health system. So that's our dogs and cats primarily, and also the farm animal system, where in the past, antibiotics have kind of been dished out like candy without real stewardship to make sure that they're available to use in the future. And so with that in mind, what are the most common conditions that we see that don't need antibiotics, where in the past it may be that they have been given out by your vet? For me, I guess the most common is probably diarrhea. We see this all the time, and very often in the past people would come in requesting antibiotics. That's less of an issue now. I think more people are aware that we don't need antibiotics for an otherwise simple case of diarrhea. I mean, after all, if you have a bit of a funny tummy, how many of you are running to the doctor to get antibiotics? Not many. We can manage this in our dogs and cats with dietary management. So that's giving prebiotics and probiotics and specifically formulated intestinal diets, which do a very good job of clearing up this simple diarrhea. Antibiotics can actually be counterproductive because they're not targeted to a specific type of antibiotic in a specific type of bacteria in a specific location. They will often attack and kill multiple different types of bacteria in locations across the whole body. So as well as the gut, it will be their skin, ears, nose. And if we're disrupting the normal bacterial flora, so those normal bacterial populations, then that can actually cause problems in other parts of the body, as well as actually making the diarrhea worse and go on for longer. Kennel cough is another common problem that we see that is caused by a virus. In the vast majority of cases, there are bacterial causes. And if we are getting this infection with Bordetella bronchoseptica, which is the bacteria that can cause quite nasty kennel cough, then antibiotics absolutely are appropriate. But for the majority of cases, we're dealing with a viral disease and they don't make any difference at all. For our cats, cat flu is a very similar situation. They're caused by viruses, herpes virus, calicivirus, and giving antibiotics really doesn't help. Now, for those cats that are really badly affected, again, there may be secondary bacterial infections, which is where we get the incredibly snotty noses, the really gummed up eyes. And if that's the case, then yes, antibiotics are appropriate, but that's not every case of a cat who's sneezing or has got a little bit of a watery discharge from their nose or eyes. Sticking with cats, cystitis in younger cats especially is very rarely caused by a bacterial infection. Now, that's different in dogs as it is in people, where actually a bacterial infection is very common. And so antibiotics absolutely are appropriate. Although even here, we're tending towards giving a much shorter course of antibiotics. But for cats, it's normally caused by stress. So if you're seeing your cat straining, maybe if they've got blood in their urine, actually a stress or a problem with stones in the bladder, for example, is much more common. And again, antibiotics is not going to be appropriate. Superficial skin infections is another one where in the past we often would give antibiotics, but we're recognizing that topical therapy, so the most common thing that I will use here, for example, is a chlorhexidine based shampoo or wash. Now, chlorhexidine is a natural antiseptic, and it does a very good job of clearing up a superficial skin infection. Now, again, if that's getting worse and worse and it's developing into a deeper infection, then yes, antibiotics may be needed. But in the first instance, we can get away with shampoos, with topical lotions, maybe in slightly worse conditions, a topical antibiotic rather than giving an oral medication, which will limit the effects on the wider body as a whole. And for me, I think a big part in the reduction in the use of antibiotics across the veterinary profession as a whole, and actually it's really to be applauded, the use of antibiotics across the veterinary industry in the UK, certainly I've got the information, has been reduced by 50% in the last 5 years or so. So that's a huge reduction without any compromise to the care, the well-being and the health of the patients that we serve. Now, some of that is due to a reduction in use in farmed animals, in your sheep, in your cows, in your pigs. But a lot of that is also due to a reduction of use in our pets. And that's really to be applauded. For me, when I think back to when I first graduated, I can think that we were using more antibiotics, and we were also using antibiotics that we could have got away with using a different, less serious antibiotic, if you like. There are certain antibiotics that we kind of try and reserve for more serious infections because there are other alternatives and because for some serious infections, they are the only option. And if I think back, we used to use those a lot more frequently, whereas we tend to reserve those for cases when there's really no other option and we've got a culture result to prove that. The other thing I find is that as I've kind of developed in my career, I'm a slightly older vet, I've developed a few grey hairs, I'm much more comfortable with having that conversation with my clients that actually antibiotics aren't appropriate. Maybe we can manage this condition with just diet, with just a shampoo. It may be that we have to reassess if things aren't progressing and improving as we would like. But in the first instance, having that discussion that antibiotics aren't appropriate and actually, no, I'm not going to dispense them for you. As well as me having that discussion, I think it's also helped that I'm sure you're aware of this problem to some degree anyway, without even listening to this podcast. So I think that's helped have this discussion in a much more open manner without feeling maybe guilty or worried that an animal is going to get worse and an owner is going to come back really angry that they weren't given antibiotics in the first case. And so in preparation for today's episode, I also put out the call on my YouTube channel about this topic and asking if anybody had any questions. And Ines, who is a channel member, came through with some really fantastic questions. The first is, are there any type or brand that are better to avoid in cats or ones to recommend? The same question could be asked of dogs, but I know Ines is a mad keen and super enthusiastic and really dedicated cat owner. So the simple answer here is, are there any ones that are better, ones to recommend? No. So as I've said, we don't think of antibiotics as being stronger or weaker. We think of them as having different spectrums of activity and different types of penetration in different tissues. So really, it's the most appropriate antibiotic for that particular condition, that particular infection in that individual animal. So as long as your vet is making that rational choice and they're thinking about things, then there's not one that's to be recommended over any other in the broadest sense of the word. Are there ones that we should be avoiding? Well, we need to think that antibiotics, like all drugs, like all potential treatments that we're giving our pets, do come with a risk of side effects. And so with that in mind, we need to weigh up potential side effects of certain drugs compared to other options that we may have to treat that same infection. Thankfully, the side effects or serious side effects with antibiotics are very rare. The most common are being maybe a bit of diarrhea because, as we've already discussed, those antibiotics are not selecting for just one particular type of bacteria in one particular location. It affects bacteria across the whole body. And so by knocking out the normal growth of bacteria in the intestine being the most common place, we get a little bit of a disruption. And actually that can last for upwards of a month, not necessarily the diarrhea, but the disruption to the normal population of bacteria. So it can take a month, even 6 weeks to get back to normal. But other antibiotics do have certain problems. So for example, in cats, enrofloxacin, and the most common trade name here is going to be Baytril. That can, in very, very rare cases, cause retinal degeneration, so actually causing blindness. A drug called metronidazole, which is a completely different type of antibiotic, can cause seizures, especially if given at a very high dose. Doxycycline, which is commonly used for cats with respiratory disease, can cause burning of the esophagus if it's not given appropriately. So we tend to give that follow it down with water and give it with food so that it's kind of washed down into the stomach and doesn't get stuck in the esophagus. So there are certain precautions and certain considerations that we need to make when we're deciding which antibiotic to use and how we are detailing that antibiotic to be given. But your vet should be talking to you about all these things. So the next question was, should cats get probiotics if they're taking antibiotics or some other type of GI help? So we've just spoken that diarrhea is the most common side effect. Now, depending, I guess, on how sensitive your pet's tummy is, depends on whether you need to give them probiotics. I don't think it's ever going to be a bad thing. It's never going to hurt. It's important with probiotics that we give a pet-specific probiotic because their bacterial population is very different to the human one. Now, if you're giving human probiotics, it's not going to hurt your pet, but it's probably not going to help them, or certainly not help them as much as a pet-specific one. So the ones that I like to use is something called Fortiflora. So it comes in a dog and a cat flavour, if you like, and they're very effective. They've got some good data behind them, and they're a high-quality one as well. So you can be sure that you're giving what you think you're giving, which is not the case with some other probiotics as well as supplements as a whole. And then is there anything else an owner has to look out for besides giving it at the exact dosage, time and duration as the vet has said? I think it's important that we don't just assume that they're going to work. So if you don't feel that you're getting and you're seeing the response in your pet that you would expect, then getting in touch with your vet again to make sure that the treatment plan doesn't need to be changed, that more testing doesn't need to be given, the dose or the type of antibiotic need to be changed. So I think that's very important. Equally, on the flip side, if you find that your pet is recovering really quickly, don't just stop them. Talk to your vet before you maybe think of reducing the length of time that you're giving them, for example. And it may be that that is appropriate, but in general, it's important to complete that course because there can still be infection kind of deeper within the tissue, if you like, or still be bacteria that are kind of clinging on to existence, even when all of the clinical signs, all of the problems that you're seeing have visually resolved. So it's often beneficial to continue those antibiotics for a certain period of time past your pet recovering or the skin lesion, for example, seeming to have completely cleared up. Are there transdermal antibiotics, or is it just oral for the owner to give? There are more and more transdermal or different treatment options available, and I think there are going to be a lot that will come online in the near future. Certainly at the moment, apart from kind of topical creams for treating superficial skin infections, for example, or eye drops or ear drops for, again, those topical surface level infections, no, there's no transdermal antibiotics that will be absorbed and then effective in deeper tissues within the body. The most common transdermal medication that we use currently is, there's two, I guess, and certainly in cats. The first one is methimazole, which is for the treatment of hyperthyroidism. We tend to use that on the inside of the ear. It works very effectively and is great for those cats that are kind of pretty stressed out, which often a hyperthyroid cat is anyway, even though, most cats can be difficult to tablet. So it's a good way of getting that medication into that cat. The other transdermal, or I guess transmucosal medication that we'll often use is something called buprenorphine, which is a painkiller, and that's very effective and absorbed very well across the gums of a cat. So it might be that you're given a syringe to dribble kind of into the side of their mouth or under their tongue. But again, that's not an antibiotic and there aren't any other options. So the different options that we have apart from an oral medication or within our oral medications is there are some pastes which can be a lot easier to give. The one that I can think of here is Vibravet, which is an oral doxycycline paste. So we spoke about how that can cause problems with burning of the esophagus, but actually that paste is very easy to give and doesn't have that problem. So that's fantastic. We've also got various liquids as well. So that can be easier to administer to a cat by squirting it into their mouth and then them swallowing it without being able to spit it out. Equally, we can give medications orally in different ways. So obviously the most common one, certainly that you'll see at the vet clinic, is just popping the pill at the back of the throat and them swallowing it. But that can be incredibly challenging at home. So instead we can be crushing tablets, we can be mixing it within the food, we can be crushing it and mixing it with a little bit of butter and wiping it on your cat's leg, for example, where they're then going to groom it off, as long as you keep an eye on your cat to make sure that they are getting the medication that way. So there are different strategies that you can use to successfully medicate your cat. Equally, there are also injectable antibiotics, which are great for those animals where we're worried about the absorption from the intestine. Maybe they're too sick to actually take and swallow antibiotics without there being some risk. Maybe it's just impossible for you to medicate your dog or your cat, in which case long-acting antibiotic injections may be given, although there aren't many of those that are available. And it may be that you need multiple injections over several different days, but equally there's no point in giving a course of antibiotics if there's absolutely no way you're going to be able to administer them at home. So it's important that you do let your vet know that you're struggling so that they can come up with an alternative plan. Also, if we're considering medications as a whole, some are better given on an empty stomach, some are better given at a different time to other drugs. So if your dog or cat is on several medications, it might be that they do need to be staggered throughout the day. Some are better given on a full stomach or with a fatty meal because that improves their absorption. So it's important to bear in mind how you're giving that treatment as well as the actual dose and the timing to really improve the chance of those drugs working as best as possible.
Helping your pet live the happy, healthy life they deserve.
And so that's kind of a brief rundown of the world of antimicrobials, of antibiotics. They're incredibly useful, but we just need to bear in mind that we're all part of the responsible use of antibiotics, both in our pets and in ourselves. And so that's it for this episode of the Call the Vet show. As always, if you found it interesting, if you found it helpful, I'd love it if you could share it with a friend or family member who you feel will get something out of this. In the next episode, I'm talking with the fantastic Nikki French about dog training and how you can manage your dog who's got too much energy, or maybe they're a little bit anxious when they go out for a walk. It's certainly a conversation not to be missed. But until then, I'm Dr. Alex. This is the Call the Vet show. Take good care.
That's it for this episode of the Call the Vet show. Be sure to visit callthevet.org to join the conversation, access the show notes, and discover our fantastic bonus content. We'll see you next time.